Good morning, everyone. This is Dr. Pete Peduzzi with another podcast today on this beautiful Wednesday morning. A little bit chilly out there, but still a nice sunny day. The day before Halloween, trick or treat. I hope everyone's ready. Hope their kids are ready. Hopefully the weather holds off tomorrow night. I heard it's not supposed to rain until maybe 9 p.m., so hopefully the rain will hold off until the kids are back in the house with their candy, and hopefully they get to bed and don't get all sugared up before bedtime. You know how that goes. Well, this is American Back Centers, the disc relief centers of Pittsburgh, and we've been doing this podcast now for about a month, and this is our fourth podcast, and we do it every Wednesday morning. So I'm happy that everyone is here to listen to our podcast today. Today, we're going to be talking about some winter safety tips for seniors and just for anybody in general. Safety tips out there if you're out there in the winter, shoveling, doing things, raking leaves. We talked about that a few weeks ago. It's really very similar. We're going to be talking about that later on the show, so definitely stay tuned for that, those tips. And as always, here at the American Back Centers and the Disc Relief Centers of Pittsburgh, we've been helping people for over 50 years now, helping them with their disc-related conditions. Dr. Dennis Miskovich started this practice over 50 years ago. In the last 25 plus years, exactly 1994 to be exact, he saw the groundbreaking research by Ramos and Martin, two neurosurgeons, published in the Journal of Neurosurgery, showing for the first time, and so to date, the only research of its type proving that a non-invasive, non-surgical, FDA-approved medical device could do what it says it does. And many people still are out there claiming decompression this, decompression that. I see pump-up devices. I see massage chairs. I see traction devices claiming decompression. It's very unfortunate because anybody can claim anything that is decompression. And really, if you know anything about decompression, it's only surgery, surgical decompression, where you surgically decompress the segment, or you create negative pressure. The negative pressure forms a vacuum. And that's what VAC-C does. And this was verified through research published in a Journal of Neurosurgery, again, by Ramos and Martin, only done on VAC-C. And that's so important because there's other people out there claiming that they do the same thing. But again, I always say, where is the research? And they may have research that their traction table helps a portion of people. But again, where is the research proving that it's actually doing more than just tractioning, just stretching the body apart, creating that negative pressure, which is essential? The cause of the problem is compression on the spine. When your spine compresses over time, not in one day and not in 1 week, over a period of months, if not years, the spine compresses, the discs start to degenerate. You can see the discs start to thin on an MRI or X-ray. On the X-ray, you can see the space diminished. You can see bone spurs start to form. I show you this model almost every week. You can see how the bones start to degenerate. You can see the top here. You can see a nice healthy disc. The disc space is starting to diminish now. And you can see the bone spurs starting to form, the jagged edges that want to fuse, very much like your knee joint or your hip joint, shoulder joint, wherever there's cartilage. That cartilage is whittling away because it's not getting, number one, there's no blood supply after the age of 25. In addition, it's not getting proper nutrients because it's being compressed. In everyday things that we do, sitting, standing, bending, traumas, sports traumas, car accidents, work-related injuries, create micro traumas and compression on the spine. And over time, the spine compresses, and eventually you get what we see here. We get the arthritis, degeneration, degenerative disc disease, eventual bulging, herniation of disc pushing on nerves, creating sciatica, disc pushing into canals, narrowing those canals, creating spinal stenosis, and pain and disability. So we've helped people for the last 25 years avoid these potential disabling conditions, severe leg pain, arm pain, neck pain, back pain, whether they're diagnosed with a disc problem or not. And if you don't know if you are, come and see us. We can do the appropriate examination and history and do an X-ray here in the office or order an MRI. We have an MRI facility right across the street at North Pittsburgh Imaging, right across the street. So we heal the disc. We treat the structural cause of the problem. We don't just treat the symptoms. We see people every day going to these epidural pain clinic centers, getting epidurals, pain shots, all of these Band-Aids. And then they eventually, after they've tried physical therapy, chiropractic, acupuncture, you name it, massage, many epidural injections, steroid injections, whatever it may be, nerve blocks. They don't know where else to go, so they finally go to a surgeon and get surgery. They snip off a piece of bone or disc that's occluding either the canal or pushing on the nerve due to a bulging disc or spinal stenosis. They may give them temporary relief of their leg pain or their arm pain, but then the back pain comes back because the structural cause of the problem is not being addressed. Even with surgery, it's not being addressed. And we're not even talking about the potential of permanent complication every time they go in there and rip out ligament, bone, and tissue, causing potential damage. Scar tissue, there's always a risk of infection with any surgery. There's always a risk of blood clots that you can have with spinal surgery that can kill you. Let alone the fact that they're just snipping off a piece of bone or disc that is pushing on the nerve or occluding the canal, contributing to your spinal stenosis or sciatica. And now the spine is still compressing. So the discs are still degenerating. And it's only a matter of time till you have problems again. And then you got to go in there and clean it up again, do more surgeries. And you see most people, when they have a second or third surgery, the success rate's even less. The first surgery, success rate is maybe 50-50 at best. And then each subsequent surgical procedure of the neck or the back, of course, has a lower success rate than the first. And that's a problem. It really is. So there's a higher rate of permanent complication and a lower rate of success. Whereas with Vaxi, we have a 92% success rate. We talk with our patients if they are a candidate, if it's an option, if there's out-of-pocket expense. In some cases there is. We talk about how we can get them the treatment. In many cases, if it's not totally covered, at least the physical therapy and the chiropractic portion is covered, and many of the modalities. But if the Vaxi is not covered, then we package it into a deal where we're lowering the cost for you over the normal insurance billed cost to help it to make it more manageable for you, or even do payments to help any patient receive the treatment they need, the treatment that's actually going to address the cause of the problem, not just treat symptoms, with pain meds, epidural injections, steroid injections, and surgery, which we all know should be a last resort. So that's why we talk about this each and every week on my podcast. Of course, we have great nutritional information that we highlight each and every week as well for you, the listening public, for, good information, of course. So again, we've specialized in the treatment of these very difficult disc-related conditions for over 25 years now, whether it's a herniated disc, balding disc, failed back or neck surgery, sciatica, spinal stenosis, degenerative disc disease, and other serious health issues that other people could not help. This treatment's used in over 300 hospitals, medical clinics, chiropractic clinics worldwide. This, of course, is VAXD, standing for vertebral axial decompression. We offer it exclusively here at the American Back Centers. 3,000 patients a day are currently being treated with VAXD. So I ask you each and every week, if you're out there listening, you yourself or you know someone suffering with severe back or neck pain, unresponsive to your current treatment, you want to avoid further surgery, pain medication, epidural injections, physical therapy, or even chiropractic's not working for you, call us here at the office, 724-935-3300. We may be able to help you. And the only way you're going to know is by coming in and scheduling a free consultation at no cost or obligation. We'll sit down with you, answer all your questions, and determine if we can help you. And of course, if your symptoms are radiating in your hip, buttocks, groin, down your leg, numbness and tingling, if you have pain in the neck, going down into the arm, shoulder blade, you may have a disc condition. You may have what's called a cervical radiculopathy, where you have something up in the neck, whether it's a disc or a bone pushing on a nerve, causing the pain, the numbness in your fingers, in your hand, pain, weakness in your arm. Same thing goes in your leg, sciatic pain, weakness in the leg, the foot's dropping. You're having numbness in your toes. All very common presentations that we see with disc conditions that we see each and every day here at the American Back Centers. So again, we are doctors dedicated to bringing you long-term relief and avoiding the need for surgery now as well as into the future. Don't wait until your condition worsens. Call us today. Our toll-free number is 724-935-3300. Again, 935-3300. If you don't know anything about this technology, and again, we're the exclusive providers in the Pittsburgh area of VaxD. This breakthrough technology was developed by Dr. Alan Dyer, who is the former Deputy Minister of Health of Canada. Some of the first VaxD patients were Marilyn Lemieux, a lot of the NHL hockey players, some of the best in the NBA, Tracy McGrady, NFL, Olympic athletes, and more have used VaxD with great success because it works and it makes sense. So this technology was developed by Dr. Alan Dyer. He was the former Deputy Minister of Health of Canada. He also played a very important role in inventing the heart defibrillator. We all know that's a very, very important invention, saving many, many lives, and they should be in really any building. And it's a great invention. And the VaxD he invented with the help of other engineers, physicians, and major hospitals. And they developed this up in Canada and put it on the market in 1992. And then the groundbreaking research by Ramos and Martin, published in the Journal of Neurosurgery in 94, is where it all took off. Dr. Miskovich, the late Dr. Miskovich, who started this practice, purchased not one but two VaxD tables at $125,000 a piece. They're not cheap, but cheap is not good. If you want something, this is a computerized artificial intelligence technology, AI technology with VaxD, sensing the patient's body weight and type, allowing for a truly relaxing treatment, number one, but more importantly, getting the best possible outcomes, doing what we claim to do, creating that negative pressure, counteracting that positive compression that occurs in your spine over time, not in one day, not in 1 week, over a period of months, if not years, where the spine compresses, leading to disc problems, nerve impingement, and so on. And you need to create that negative pressure to counteract that positive compressive force, so that negative pressure is forming a vacuum, pulling water and oxygen back into that compressed spine, pulling the disc material out of the canal, relieving your spinal stenosis, relieving your sciatica, relieving your pain and disability. Traction can't do that. So-called decompression devices can't do that. Pain meds can't do that. Epidurals can't do that. And certainly surgery cannot do that. And surgery, in many cases, can cause more harm than good. We are a non-surgical, non-invasive center helping people avoid spinal surgery for the last 25 years. But we have the latest technology, the Genesis system, Genesis VaxD system, the latest technology with the best results and the increased patient comfort. People regularly fall asleep on our tables because they're so comfortable and they're finally getting the relief that they need. So again, don't wait until your condition worsens. Call us today, 724-935-3300. We're located right here in Wexford at 103 Bradford Road, Building 2, Suite 100 in the Stonewood Commons, right down the street, I should say, from the brand new hospital that Highmark built. If you know where Walnut Grill is, we're down at the bottom of the hill. Walnut Grill's at the top of the hill, right over the next hill at the bottom at the traffic light. Formerly where Atria's used to be, there's now a daycare center across from us. And right at the light, you turn onto Bradford Road, and we're in the second driveway, second building, Building 2, Suite 100 in the Stonewood Commons office complex. We're very excited. We're going to be doing a renovation, especially of our waiting room. We're going to be putting all new stone, and it's going to look really nice in our waiting room, so we're very excited about that. But our front office is in the side of the building, so patients don't have to walk steps. So you come around the side. We have devoted parking just for our patients. You walk around the sidewalk, so you don't have to walk down the steps to our front door. And our front door is right on the side of the building facing Route 19, right here in the heart of the very busy but fun Cranberry-Wexford corridor here between the car dealers and, like I said, Walnut Grill and the new hospital in the Stonewood Commons, Building 2, Suite 100. So a little bit more about what we do in addition to the VaxD. Of course, the VaxD is a medical procedure. The only FDA-approved, safe, clinically proven non-surgical disc treatment out there, used by MDs, DCs, orthopedic surgeons, chiropractors worldwide in over 300 facilities. Again, 3,000 patients a day are currently being treated. In addition, of course, we do the cervical VaxD as well, the new Genesis system. So if you have a disc problem in the neck, we address that as well, of course. Therapy and rehab, state-of-the-art facilities, instituting the best therapy and rehab, Part of our disc protocols are rehab to the lumbar spine and the cervical spine, but we do rehab for the shoulder, knee, hip, any musculoskeletal area. We do a multifaceted approach, treating those wrist, hand, finger, foot, ankle, and knee problems, adjusting the area. We have many techniques, kinesiotaping, Graston technique, which is stainless steel instruments that we get in there deep into the muscles and treat those muscle issues, tendonitis, rotator cuff, carpal tunnel, and more. We have nutritional surveys through standard process, deep tissue massage, myofascial trigger point therapy, acupressure we also offer here. We offer it all. We also have custom-made orthotics. We have a computerized digital scanning system, assessing for foot dysfunction. It's a 3D scanning system, state-of-the-art. It's totally free, and if you want to try it out, just call our office. And a lot of the problem stems from the back, the knee, the hip, even the neck, is the body's foundation. The body's foundation is in the foot. And there's many problems with the feet. If you've been walking your whole life on your feet, which we all have, of course, but if you've been on your feet a lot throughout your life, over time, there's 3 different arches in the feet. And those arches will diminish over time. And the scanning system, the 3D scan, assesses those arches and assesses if there's any problems with them, if they're lacking, if they need correction, and so on. And this gives us an analysis of the foot, and this analysis is sent to the company, Foot Levelers, that makes more orthotics than anybody in the world, the most popular company, the best company in the world. They make flexible orthotics that move with your feet. They're functional orthotics, not the rigid ones that you see at some of these other places that sell orthotics per se, and they're custom. They're truly custom to your individual foot and scan. The scan is assessed by myself with you, the patient, before we order them and send them over to Foot Levelers. If you so choose to get them made, and they can be put into any shoe, it truly makes a big difference. And most patients do choose to make the right decision and get them made, because sometimes you have knee pain, hip pain, back pain. You've been treating the back, you've been treating the knee, but there's still a little bit of pain there, and because you're not addressing the actual problems in the feet. And then we go down and look, and the arches are diminished. They're not doing what they're supposed to be doing. It's not as simple as going out and buying a Dr. Scholl's off-the-shelf orthotic. It's not custom to your individual needs. And everybody has different wear and different needs on their arches. So this makes a truly custom. And we have some of our, I have to laugh, some of these competitors out there that claim to have custom, but yet they go off the same day in the back room and pull one off the shelf. So how is that custom? And they're charging people upwards of $1,200 for a set of orthotics, and these are a fraction of the cost of that. And they're superior, in my opinion. They're far superior because they're custom. And they're sent back to us within 5 to 7 business days. We fit them to your shoe. If you want to get them put into a flip-flop or sandal, you can't put the inserts into a flip-flop or sandal. So they do offer a great deal, especially now until the end of the year. We can get that second pair, and most people get the second pair, which would be the orthotic built into the sandal or flip-flop. So you can wear the sandal and flip-flop with support, because flip-flops and sandals can be really unsupportive and horrible for your feet and toes and your back and your knees and hips and so on, make problems worse. But when you have that built into that sandal, now it's a healthy footwear for your back, your knees, your hips, helping prevent further problems with, again, those fallen arches that are contributing to wear and tear. And people wonder why one side, one knee, and the other knee is okay, and then the other knee, I should say the bad side, is almost bone on bone. Well, the issue is because that foot was probably falling, those arches are falling on that right side, we'll say, and that's why there's so much wear and tear on the one side as opposed to the other side. And then guess what? Eventually the other side has to compensate for the side that's not doing its job, so that starts to wear as well. But that's the main reason why one side wears quicker than the other. So you get those orthotics put in, you get your back fixed, you get your knee handled, but then you get those orthotics put in your shoe, the appropriate orthotics, and now all of a sudden there's less wear and tear on that knee, that hip, that back. So call us today if you want to schedule an appointment for a free consultation, foot analysis, and digital scanning of your foot, 3D scanning your foot. 724-935-3300. We also do acupressure, as I mentioned, in-house x-ray, nerve conduction testing, and we have a convenient MRI facility right across the street. So if you need an MRI, we can send you with a prescription right across to North Pittsburgh Imaging, and they get you in there pretty quick. And finally, I'm a certified personal trainer. We can get you back in the gym doing things correctly without causing more problems. Also, I do Department of Transportation physicals. Anyone who has a CDL license, truck driver, bus driver that needs a physical, we do the urinalysis and physical right here at the office. For the Department of Transportation. I'm a certified medical examiner, so if you need that as well, we have very competitive cash prices for that as well. 724-935-3300. We're going to highlight some key nutritional supplements at the end of the podcast today, but we're going to get into our topic for today, which is winter safety tips, especially for seniors. And we're going to go over the first article here. If we can get it to pop up. I got the wrong, some type of malware here popped up. Sorry about that. Get that off here. And one second here. There we go. So cold weather tips for older adults. We're going to start with the first one here first, which is winter safety for older adults. And I picked this one out because I thought this was it's from healthyaging.org. Trusted information, better care is their motto. And we go on to state, as you can read the article here, baby, it's cold outside. Well, we're lucky it's not cold outside yet, but it's getting cold. And I can see into this weekend as we change the clocks. Don't forget to change the clocks this weekend. That it's going to get colder this weekend. So as it goes on to state, when the temperature drops, older adults run a higher risk of health problems and injuries related to the weather, including hypothermia, frostbite, and falls. And we do a lot of balance training here at the office because it's very important. A lot of people don't realize, and it just really hits them in the face, per se, out of the blue, where their balance and the proprioceptive centers in their brain, as we get older, what happens? The brain deteriorates, right? So as the brain deteriorates, balance centers deteriorate as well, and you're more likely to have a fall. And when you have a fall, it can set off all types of issues, not including pain, back pain, leg pain, hip pain, etc. So even if you're not an older adult, I'm sure you know one. You have a father, mother, grandmother, grandparent that may fit into this category. And these are even good tips for anybody, really anybody. So again, hypothermia, frostbite, falls in the ice and the snow. Like most things in life, it's better to be prepared. Here's a few precautions everyone should take, especially older adults during the winter. So we talk about hypothermia. Hypothermia occurs when the body temperature drops to a dangerous level. The body's temperature can drop when you're out in the cold for extended periods of time because it begins to lose heat very quickly. So especially if you're not wearing a hat or gloves or proper footwear, that's where the majority, the peripheral areas, the head, the fingers, the toes, where you lose heat the quickest. So older adults are at an increased risk of hypothermia due to the changes that happen as we age to the body. Some of the warning signs, if you have cold skin that's pale or ashy, you're feeling tired, exhausted, confused, sleepy, feeling weak, problems walking, slow breathing, or a heart rate. Call 911 if you think you or you're someone that has hypothermia. Any of these signs, definitely get inside and get warmed up. And if it's not getting better, then of course call 911. A note here, as you can see here, shivering is not a reliable warning sign because older people tend to shiver less or not at all when their body temperature drops. And that's really scary to think about that. As you get older, you're shivering less, so you have less of that warning sign that hypothermia is coming about. So some precautions to take that they recommend: staying indoors or don't stay outside for very long. Keep indoors at a temperature of 65 degrees or warmer, so try to keep your thermostat at 65 or warmer. Stay dry because wet clothes, when you get wet outside, chills your body more quickly. Dress smart. Protect your lungs from cold air. Layer up. wearing 2 or 3 thinner layers of looser fitting clothing is warmer than a single layer of thick clothing. And think about getting your thermals on as well. So wearing that thermal underwear, wearing thermal clothing, it's good for keeping heat in and layering up, of course. You can always take layers off. Essential winter wear. Wear hats, gloves, preferably mittens, especially if you're older, because that's going to help retain heat better. Winter coat, boots, and a scarf to cover your mouth and nose. We talk about frostbite, and that's the worst case scenario now. Frostbite occurs when your body experiences damage to the skin that can go all the way down to the bone. Not surprisingly, extreme cold can cause frostbite, and it's likely to occur on body parts furthest away from the heart, as I mentioned, the periphery. Common places include your nose, your ears, your cheeks, your chin, your fingers, and your toes. In severe cases, frostbite can result in loss of limbs. People with heart disease and other circulation problems are at higher risk. So as I recommend, cover up. All parts of your body should be covered when you go out in the cold. If your skin turns red or dark or starts to hurt, go inside right away and get warmed up. Know the warning signs of frostbite. Skin that's white or ashy or grayish yellow. Skin that's hard or waxy, numbness. If you think you yourself or someone you know has frostbite, call medical help immediately, whether it's 911 or call the neighbor or call anyone to get immediate help. If frostbite occurs, run the affected area under warm, not hot water. Again, warm, not hot water. So some other issues, injuries while shoveling snow. It's one of the evils of winter, snow shoveling. If you choose to shovel, take some precautions. Remember, when it's cold outside, your heart works double time to keep you warm. Strenuous activity like shoveling snow may put too much strain on your heart, especially if you have heart disease. Shoveling can also be dangerous if you have problems with balance or have thin bones or osteoporosis. Ask your healthcare provider whether shoveling or other work in the snow is safe for you. Now, it's very important to note, you may not be somebody that should be doing that, whether you have a heart condition or any other condition that may make you more susceptible to injury. So always talk to your doctor. Falls, very, very important. It's easy to slip and fall in the winter, especially when it's icy or snowy out. Some precautions to take. Make sure steps, walkways are clear before you walk. Be especially careful if you see wet pavements that could be iced over. And sometimes, like we call it black ice, it's hidden or it's hidden under the snow. Always be cautious. Always assume ice is there. Always assume that. So you're precautious and aware so you don't fall. Clear away snow and salt from your walkways at home or hire someone to do it. Wear boots with non-skid soles. This will prevent you from slipping. If you use a cane, replace the rubber tip before it's worn smooth. Consider an ice pack-like attachment that fits over the end of your cane for additional traction. Ice pick, I should say, not ice pack-like attachment that fits over the end of your cane for additional traction. So you can really dig into that ice, even break up the ice, let alone dig into the snow. Fires and carbon monoxide poisoning, also very important. During the winter months, it's common to use the fireplace or other heating sources such as natural gas, kerosene, or other fuels. Unless fireplaces, wood and gas stoves and gas appliances are properly vented, cleaned, and used, they can leak dangerous amounts of carbon monoxide, a deadly gas that you cannot see or smell. These and other appliances, such as space heaters, can also be fire hazards. So some of the warning signs that you may have carbon monoxide or fire poisoning is you're having a headache, severe headache, weakness, nausea, vomiting, dizziness, confusion, blurred vision, and loss of consciousness. If you think you may have carbon monoxide poisoning, get outside, get some fresh air, and get medical care immediately. Some precautions to take. Call an inspector to have your chimney and flues inspected, preferably once a year. Open a window while using a kerosene stove. Just a crack will do. Place smoke detectors and battery-operated carbon monoxide detectors in strategic places throughout your home. especially in areas where you use fireplaces, wood stoves, and kerosene heaters. Make sure space heaters are at least 3 feet away from anything that may catch fire, such as curtains, bedding, or furniture. Never try to heat your home using a gas stove, charcoal grill, or other stoves not made for home heating. If there is a fire, don't try to put it out. Leave your house and call 911. Don't be a hero. Leave your house and let the fire authorities take care of it, because you can cause more harm, and you can actually pass out with the poisoning of the fire and the carbon monoxide, and then you're really up Schitt's Creek. Accidents while driving. Adults 65 and older are involved in more car crashes per mile driven than those in nearly all other age groups. Winter is an especially important time to be vigilant when driving, because road conditions and weather may not be optimal. Some precautions to take. Winterize your car before bad weather hits. This means having the antifreeze, tires, windshield wipers checked and changed if necessary. Don't wait until you're in the middle of winter to have to change your windshield wipers or your antifreeze or get new tires when you're sliding over the road, or worse, sliding into another car or off the road, causing a car accident or injury to yourself. Remember your cell phones when you drive in bad weather, and always let someone know where you're going and when you should be expected to be back. So yes, have that phone with you. Don't have it when you're driving, of course. Don't text when you drive. Don't talk when you drive. But have it with you in case you get stranded or you get into a car accident. And always let someone know where you're going and when you're expected to be back. Avoid driving in icy roads, and be especially careful driving on overpasses or bridges. Consider alternate routes, even if it means driving a longer distance. If the more direct route is less safe, often bigger roads are clearer of snow better than smaller roads. So stick with the interstates, stick with the highways, then there are back roads which are not going to be cleared as well as your interstates. Stock your car with basic emergency supplies such as a first aid kit, blankets, extra warm clothes, booster cables, windshield scraper, a shovel, rock salt or a bag of sand or kitty litter in case your wheels get stuck, water and dried food or canned food with a can opener, flashlight, and a map if you're traveling in a new area. So we talk about the food, having that can opener in there as well. If you have canned food, you can't open it if you don't have the can opener. So a lot of people forget that, but more importantly, having the water there, I think, is important. If you're stranded somewhere, of course, having that blanket, first aid kit, booster cables, extra warm clothes, that shovel, window shield scraper as well, in case you break down. Very, very important. So these are some healthy tips. I should say some winter safety tips from healthyaging.org. So I hope you enjoyed that. A little bit I wanted to share with you. We have some other cold weather tips for older adults here as well. We're just going to skip on down here. Just some of the medical conditions I wanted to highlight. If you're diabetic, you're more prone to having problems with cold weather because, of course, if you're diabetic, this can prevent blood from flowing normally to provide warmth. Thyroid problems, of course, people with thyroid problems can affect the body's ability to maintain a normal body temperature, especially if it's a hypothyroid, underactive thyroid gland. Parkinson's or arthritis can make it challenging to put on more clothes, use a blanket, or get out in the cold. If you have arthritis, you have pain in your wrists, your hands, your back. Parkinson's as well. Memory problems can cause a problem to forget to take precautions and forget to do the things we're mentioning here in these articles for staying weather safe, such as wearing appropriate attire. Also, some medications can affect body heat too. These include prescription medications, those bought over the counter, such as some cold medicines. Always ask your doctor if medications you take may affect your body heat and what you can do about it. Of course, we talked about frostbite and hypothermia as we skip on down here. Preventing unsafe exposure to cold outside. Basically, again, just telling you to wear that hat, that scarf, those gloves, those mittens, extra blankets in the car. Wearing a waterproof coat or jacket is something we didn't talk about in the other article if it's snowing or rain, because you want to stay dry. That's so important. Change out of damp clothes or wet clothes as soon as you can, because again, if you're wet, you're going to lose more heat more quickly. We talked about avoiding falls, using railings to help avoid slipping on ice, stairs, walkways. You wear a non-skid, rubber-soled, low-heeled footwear. Don't wear those high heels. Heavens forbid. They look pretty, but don't wear them out in the ice and the snow. You're going to kill yourself. You're going to break your ankle. You're going to fall. Avoid shoveling snow yourself when possible. In addition to the risk of falling, there's a risk of heart attack if you're shoveling by yourself. And then what would happen if you're there laying in the snow by yourself alone? And again, keep those outside walkways clear of snow and ice, and using an ice melt product or sand is very, very important. And the rest of this we pretty much talked about. There's some other tips here about finding help for heating bills, especially if you're older on a fixed income. Contact the National Energy Assistant Referral Line at 1-866-674-6327, and they can give you some information on low-income Home Energy Assistant Program, otherwise known as LIHEAP. Increasing the energy efficiency of your home by keeping heating bills down. There's some weatherization assistant program out there that helps you with that, where they can help lower income people or people on a fixed income. If you're retired, weatherize your house. Get some caulking done, seal up those cracks, get those windows replaced, all the things that are letting that hot air out and letting that cold air in. So these are some nice safety tips, especially as we get into the winter months, that I just wanted to share with you guys. I hope you enjoyed that from our podcast, this crazy male guard here. We have Working Safely in Cold Weather PDF. If you'd like a copy of that, you can call our office and get that as well. More than happy to send it out to you here at the office, here at the American Back Centers. Again, we've been helping people for over the last 25 years avoid the potential permanent complications with back or neck surgery, spinal surgery, with the latest and best technology. We do the rehab, we do the physical therapy as well here, chiropractic care, nutrition. As I mentioned, I'm a certified medical examiner. We can do the Department of Transportation physicals and urinalysis as well. We do it all. Graston technique. We have many different techniques here, nutritional surveys. We not fit them, but we have a 3D scanning system for the foot, assessing the arches, for custom-made orthotics as well. So we offer many, many services here, all under one roof, including we do x-rays here in the office as well. As I mentioned, Graston technique, deep tissue massage, muscle work as well. We do it all here. And we also have a new technology. It's called the Microlight. It's cold laser therapy. We've had a lot of people come in with shoulder, knee problems. We also use it as part of our disc protocol at no charge. We don't charge. It's bundled in with that protocol with the disc patients. We're seeing even better results with people coming in with acute inflammatory discs and nerves. If you have shoulder pain, knee pain, come in for a laser consultation. And in as little as 6 treatments, we've seen people with their knee pain, shoulder pain gone. And it helps regenerate tissue as well. So a wonderful, wonderful treatment. And finally, we have the exciting Invisared technology. This is a laser, but this is not a laser for pain. This is a high-intensity laser for weight loss. And if you can picture your fat cells as grapes, well, it turns the grapes into raisins, dehydrating those grapes, pulling and dehydrating those fat cells with a high-intensity laser treatment. And most people do it on the stomach and the back. I mean, you can do it anywhere you want, anywhere you have fat deposits, but you're getting true spot reduction. And most weight loss programs don't give you spot reduction. So we combine the Invisared laser technology with the ChiroThin weight loss program that we offer here. Basically, it's homeopathic drops and a turnkey weight loss program. You don't have to buy any packaged foods. You don't even have to exercise if you don't want to. They guarantee 20 pounds of weight loss, at least 20 pounds of weight loss in 6 weeks if you follow the program. So they give you a booklet. They tell you what to eat, what not to eat. And the list is pretty darn long of the foods you can eat. So it's not that restrictive. With the homeopathic drops, they work on the natural body's mechanisms of fat storing, the hormones that store fat, and the fat burning properties of the back naturally. So you not have to worry about any side effects. So their homeopathic drops, B12, and another proprietary formula that Chirothin has. And again, immediate weight loss. You're eating the right foods. You're taking the drops. You're getting the Invisared. You're getting the spot reduction. People are seeing inch loss, fat loss, and weight loss with this wonderful program we offer here at the Weight Loss Centers of Wexford. That's what we're called, the Weight Loss Centers of Wexford, the Invisared part, combining the Invisared with the weight loss program. Truly ultimate results. We guarantee you will lose 20 pounds in 6 weeks, and you will lose inches. In fact, we're so confident, we offer a free demo treatment of the Invisared for our current patients. Anybody out there listening to the podcast, call us. You can schedule a free demonstration treatment. When I say demo, you're getting a free full Invisared treatment. Every single person has done this, has lost at least 1 inch. We've had people lose upwards of 4 or 5 inches in the one first treatment. Now, there's 2 measurements. They lost 2 inches at the first measurement and 3 inches below the belly button. So for a total of 5 inches, because you may be asking, how could somebody lose 5 inches with one treatment? But it's truly remarkable. The Invisared technology, inch loss, fat loss, and weight loss. And then you combine that with a homeopathic natural weight loss system we have here called Chirothin. Truly remarkable results. If you want to try it, give us a call, 724-935-3300. Call and ask for the free initial session. Normally it's $300-400 value. If you're listening to this podcast, tell them you heard it on the podcast and call us 724-935-3300 again to get your free Invisared session. It's not going to last long, but we're going to be offering it here for the time being. It may come and go, the offer. We may do it periodically throughout the end of the year and into next year, depending on, how I'm feeling, I guess. But we're so confident. We're so confident it works. We offer it to you, and most people see it, and they just can't believe it. And they sign up right away for the weight loss program and the Invisared program. So basically, when you sign up for the Invisared, you get the weight loss program at no charge. If you were doing the weight loss program separately, there may be some cases if you had like an autoimmune disorder or if you were pregnant, that you could not receive the Invisared laser at that time, and you could only do the weight loss program. The weight loss program is a certain cost. We include it at no cost when you do the Invisared program, so we're doing it together if you're able to do the Invisared. Most people are able to do, they are a candidate, but again, the only way you're going to know if you're a candidate for the Invisared or if you're a candidate for the Vax-D treatment, if you have a low back issue that's not getting better, if you have a neck issue that's not getting better, you've been told you may need surgery, you want a second opinion, call us first, 724-935-3300. I hope everyone enjoyed this podcast today. We'll be on next Wednesday morning. Have a good week. Bye-bye. It's Dr. Peter Peduzzi, the American Back Centers. Remember, you have nothing to lose but your pain. Have a good week, guys. Bye.